Housekeeping services in hospital or a healthcare facility. So housekeeping services, there should be a well-defined place for everything and anything and everything should be in its place. It's central to housekeeping services. So housekeeping services make sure that all the things are kept in clean and well-defined places. All hospital activities directed towards clean, safe, hygienic, aesthetic, and comfortable environment is called hospitals housekeeping. So functions of the housekeeping services will include clean the rooms, corridors, wards, floors, roofs, fixtures, curtains, windows, and toilets. Hospital waste disposal, be involved in the biomedical waste management, sanitation and basic hygiene of the public areas, order control, control of pest, flies, rodents, and stray animals, prevention of fire, be thorough and well trained in safety hazard and fire safety, hospital equipment maintenance, hospital infection control, replace the supplies in utility room as and when required, interior decoration, the asset ambience and interior decorandum of the hospital should be maintained, and perform all the management tasks. Types of housekeeping. There are two types of housekeeping: in-house services and contractual services or outsourcing. In-house services, the staff is required by the hospital itself and the services are maintained by the hospital housekeeping services. In contractual or outsourced, either the hospital housekeeping services are handed over to a third party for maintenance, or a private party on outsourced basis will be hired to provide housekeeping services to a hospital. What is the advantage here in outsourcing is it relieves the hospital management from the burden of housekeeping services. These contractual services are experts in interior decoration, and they reduce the cost of staffing and recruitment from the hospital side, and they reduce the cost of maintenance of housekeeping equipments. So activities include sanitation. It includes basic cleaning and cleaning of physical facilities like dusting, mopping, sweeping, polishing, washing, etc. Maintaining of equipments, floors, hospital equipments, etc. Order control, to control the bad odors emitting from various patient care areas, hospital waste disposal, collection, transportation, disposal of the biomedical waste, pest and rodent control, control of stray animals so that no stray animals are getting into the hospital premises or within the building, the hospital linen supply, procure from store the linens, wash it, clean it, and send it to the user departments, linen supply. Then housekeeping equipment maintenance, maintain all the equipments, proper placement, dusting, covering the equipments when not in used, and regularly washing the equipment, etc. Then we have management task, which has to be followed by the hospital housekeeping, planning the services, planning which area to be cleaned on regular basis, organize all the equipments required to clean that area, show leadership and liaison abilities with other department staffs, implement your housekeeping services into the wards, control wherever controlling is required, controlling tasks should be performed, evaluate the housekeeping services on regular basis through feedback from the staff, patients, etc. Teamwork, that is total effort of all members should be the policy followed here in housekeeping services. Attitude of the housekeeping staff should be towards infection prevention and control. The skilled staff should be hired and they should have basic knowledge about basic infection prevention control, basic fire safety, etc. Criteria of a good cleaning agent. It should have good cleaning property. It should not be toxic to the handlers. It should possess good microbicidal property. It should kill most of the bacteria and viruses and fungus present on the surfaces. It should be a deodorant to take care of the malodor. It should be economical, not too expensive. It should be cost effective. It should not be corrosive to the floors. Most commonly used housekeeping equipments are scrubbing machines, vacuum cleaner, fumigation machines for OTs and other user units, ultrasonic control devices to control the pests and rodents, everyone, and dustbin, garbage bin, mopping machines for mechanized cleaning, etc. These are the most commonly used housekeeping equipments. Quality assurance program. uses the 5S technique when it comes to housekeeping. Sort, that is clearly distinguish the things which are required and not required. Things that are not required, you have to dispose them off, and things which you are required, you will straighten them. That is, keep the things required in the correct place, which will allow easy maintenance and immediate retrieval. And after straightening them, keeping them in correct place, you have to make sure they shine. Keep the workplace neat and clean. Regular cleaning of the area should be done. Then standardize. The method by which sort, straighten, and shine are made habitual, that is standardized. What standard you are following here, always keep following the same thing. Do not go back to the old procedures and policies which were before the implementation. Sustain, there should be a leader who makes sure that all the 5 S's go hand in hand. This is the 5S technique used in housekeeping. Thank you.